Our heart muscles are supplied mainly by coronary arteries, right coronary artery and left coronary artery. Those coronary arteries are reliable to atherosclerosis. Actually, they are the second commonly affected artery after abdominal aorta. Atherosclerosis, as you know, narrows the lumen of the artery. Narrowing exceeding 70% of the lumen gives stable angina, makes the patient reliable to stable angina. A stable angina, if 70% occlusion, then there is remaining 30% of the lumen. Those 30% may be enough at rest, but if he did exercises, the heart rate and contractility increase, the heart muscles need more oxygen, so the heart muscle will suffer from ischemia, ischemic pain, severe chest pain that radiates to the shoulder and the arm. This pain is reversible. It will stop when the patient stops exercise and the heart now is in rest, or if the patient took sublingual nitroglycerin. Nitroglycerin decreases the preload, decreases the blood returning to the heart, so the heart exertion will decrease. And this is the first type of angina, stable angina. The second type, unstable angina. Unstable, why is it called unstable? Because at any time, any atherosclerotic plaque could rupture and swim inside the lumen of any coronary artery and occlude the lumen. About less than 90% occlusion of the lumen can occur at rest or at exercise, and this is the first difference between a stable and unstable angina. The third type of angina is called vasospastic. The name tells you vasospastic, so vasospasm in coronary artery. Some people are born with hypersensitive coronary artery muscles to smoking, to cocaine, to alcohol, to triptan. This hypersensitivity, when the patient is predisposed to any of those substances, his coronary arteries will occlude. 100% occlusion, vasospasm. Fortunately, angina lasts less than 15 minutes. So the patient pain, the patient damage will be reversible. He will return back normal. If this obstruction exceeded 15 minutes, it will be irreversible. It will transform into myocardial infarction. And let me tell you an important point. This is a cut section of myocytes, ventricular myocytes. The first area in myocytes affected by ischemia, this area, subendocardial region. This area has poor blood supply. So if someone is reliable to either angina or myocardial infarction, this is the first area affected. And when this area suffers ischemia, this will lead to ST segment depression. If the whole layer if the whole layer affected, like let's say if there is complete 100% complete occlusion of a coronary artery, the whole wall layer will be affected, presenting as ST segment elevation in ECG. I'm telling you this to help you differentiate between each type of those angina subtypes with ECG. Since I told stable angina 70%, unstable angina 90%, then those will present as non-ST segment with ST segment depression. They will present as ST segment depression, while vasospastic angina 100% of the lumen ST segment elevation. Okay, so angina, chest pain that is reversible, transient, less than 15 minutes. ECG, ST segment elevation with vasospastic, ST segment depression with stable and unstable. Then how to differentiate between stable and unstable? Stable angina at rest relieves with rest. Stable angina with exercise and relieves with rest, while unstable angina could occur at rest. As we just discussed, if the obstruction persisted more than 15 minutes, okay, like if there is atherosclerotic plaque ruptured, occluded the lumen, persisted more than 15 minutes, it will be irreversible. The heart muscles will die, myocardial infarction. This is let's say this is the cardiac myocyte. When a cell dies, the cell membranes rupture, releasing their contents of enzymes. Enzymes like what? Creatine kinase, because this is a myocyte, creatine kinase is inside. Releasing cardiac enzymes like troponin and myosin. So, and we use those markers to differentiate between angina and myocardial infarction. So at emergency department, the patient complains of a chest pain. I did ECG. It could be ST segment elevation or ST segment depression. I will order cardiac enzymes. If they are high, then the muscles die. This is MI. If they are low, then this is angina. The muscles are still alive.